So here we have a chest CT that demonstrates bilateral consolidation and ground glass opacity, which looks to be perhaps zonally basilar predominant, though there's certainly mid and upper lung preponderance as well. There are areas that are clearly involved, for example, in here. And in terms of the axial plane, the distribution looks to be relatively diffuse. Doesn't look to be peripheral, doesn't look to be particularly central lung preponderant. So if we look at the pattern of abnormality relative to the underlying secondary pulmonary lobular anatomy, I think there is a striking finding. A lot of these areas of ground glass opacity and consolidation look like they're involving the margins of secondary pulmonary lobules. So we would call this a perilobular pattern. And we know that in the setting of a perilobular consolidation pattern, one of the first things that we think about is organizing pneumonia. So that's what I thought this was going to be. Believe it or not, this actually turned out to be eosinophilic pneumonia. And so I don't think that we're wrong here, because eosinophilic pneumonia certainly could have components of organizing pneumonia. And so some people think that they are essentially cousins. They maybe are same spectrums of inflammatory disease, but this is clearly eosinophilic predominant. I have been asked by some people, well, if you see this pattern, do you automatically just jump to organized pneumonia? Are you done? Not always. Obviously, you got to correlate with the patient's clinical presentation. Sometimes it does require tissue sampling to figure out what's going on more definitively. But I tell you, in the subacute chronic setting, if you see this pattern, that's probably what you're dealing with. If we look at the comparison CT, so the comparison CT here is from about 6 months ago. We see a similar distribution of abnormality. Perhaps in some areas, maybe a little less perilobular. Some areas there's a little bit more patchy ground glass opacity, but this sort of affirms our belief that this is an inflammatory process. And this is certainly subacute, actually more than subacute, this is chronic. And so once you get to that chronic level and you see this pattern of abnormality within the lung parenchyma, now you've changed your differential diagnosis from your run-of-the-mill aspiration or pneumonia, and now we're talking about more interesting things. And so, for example, like this, an eosinophilic pneumonia, or perhaps an organizing pneumonia.